Welcome back to Valley Life. I am Alicia Safias, and today we're hearing more inspirational stories at the Pacific Medical Center of Hope. Thanks to Dr. Nizami. Thank you for being here.
Thank you for coming.
Now, we have heard a slew of different patients coming in, even just today, telling us their stories about trying to do conventional cancer treatments, maybe not responding very well, or having their cancer come back and then saying, you know, I want to try something different. And that's what you're here for. Kind of give us an overview of what you do.
Yes. In a nutshell, cancer comes back when there is resistance in the cancer. When you use chemotherapy and other traditional methods of treatment, cancer may become more aggressive. DNA goes through the mutations. There are multi-drug resistant genes that become activated. And that's why the cancer has a more tendency to return and recur with more aggressive features. If you don't use the right appropriate treatments along with chemotherapy, the risk of recurrence may even increase. And that's why we see that sometimes patients go through the chemotherapy, they respond very well. After a while, the cancer comes back and the chemotherapy doesn't work anymore.
There are so many things that are happening in cancer research, more things that you're learning every day. A lot of things have to do with genetics, and you really pay attention to that here. Explain that.
Yeah, thank you. So yes, the difference between what we offer and the traditional ways of treating cancer is that we target the genes and epigenetics. And that's my field. In other words, I'm an expertise in epigenetics. I teach in the university-based institutions. I collaborate with National Cancer Institute for the same reason, is because we have come to the conclusion that unless you target the genes with targeted therapies that control the resistance of the cancer and make it more susceptible and sensitive to the chemotherapies, you always have to think about the recurrence of cancer. So the treatments here target the cancer stem cells. We have also done studies that show synergistically they work along with chemotherapies, and they also have independently have significant anti-tumor effect. And so patients come here, they have recurrence, and we tell them that we can start the treatment in a matter of just a few weeks. Their tumor markers respond. In a matter of a few months, their cancer responds in the scan. And the reason that it happens is because it works on the genetic level. It targets the cancer stem cells. As far as I know, there's no other place in the whole United States, and maybe globally, that they have any treatment that targets cancer stem cells.
And that is why you have people coming from all over the country and sometimes around the world to come and see you. Arlene, give us kind of your background with cancer and how you found your way here.
I was diagnosed December 23rd of last year with non-Hodgkin's lymphoma. We went first down to USC Norris, and they worked with my doctor in Bakersfield, and I went through 8 rounds of chemo and finished chemo in June and had a PET scan then, and I was clean and in remission. And then my sister-in-law happened to find Dr. Nizami online looking for somewhere to come because she was interested in chelation therapy. And so she said, why don't you come up and talk to him? He also does integrated cancer care. And I'd never really heard of that, but I thought, well, if I'm going to do it, now's a good time to do it because I'm clean. And so I came and talked to him, and we were impressed with what we saw and some of the results that he had. And so I started initially with 2 weeks with him every day. And we would drive up from Bakersfield, and now I'm doing once a month. I feel great. I feel better than I have in a couple years, and I can't say enough on the people here and how you know, when you go through cancer, they just tell you to go live your life. That's all they tell you. Know, they don't, and maybe change your diet, but you know, something got me here. DNA, stress, you know, something gets you here, gets cancer to take off. But once you go through chemo, they don't really give you too much in how to prevent it from coming back and once you've had the cancer. And so this was something that we worked on here. Diet, I changed my diet dramatically, and I have been following what he suggested, and I'm happy with what I see. I'm happy with the results that I see in people that come through here. And he has people that come from all over the country. So it has to be something good if other people think enough of it that they're coming in and doing what we're doing and making the investment in themselves to try and make this stop.
Again, Dr. Nizami here at the Pacific Medical Center of Hope. Come in and have a consultation. And Valley Life will be right back.